All right, I think we're gonna get started. Good day and welcome to today's webinar in Healthcare Excellence Canada's Community Dementia Care and Support Discussion Series. This webinar series began in June of 2020, and today we'll be hosting our final webinar in this series. I'm Neil Dreimer, and I'm so delighted to be your host today. Please note that this session is being recorded. We are pleased to offer French simultaneous interpretation today. If you would like to hear the discussion in French, you can simply select French from the interpretation icon at the bottom right-hand corner of your screen, which is really under the globe picture. So again, if you want to hear the discussion in French, select French from the interpretation icon at the bottom right-hand corner of your screen. If you are connected on a computer, not a mobile device, you can also select the language of slides you would like to see. From the green bar you see above the slides, please select View Options. From the menu that appears, you can then select English to see the English slides, or select Français to see the French slides. And we will, if you have any questions about this, feel free to also input them into the chat box. We invite you to share your questions and comments throughout the session using our chat box in either official language, which you can find on the bottom of your screen. Feel free to also raise your hand under the reactions icon if you prefer to ask your question verbally. We'll take time to address these towards the end of today's webinar, but encourage you to use the chat box or raise your hand as we go along. We also wanted to let you know that recording of today's session will be available on our website within 2 or 3 business days. And we will summarize the chat questions and comments after today's webinar for sharing in a post-webinar synopsis, which we aim to get on our website within the next few weeks. I also wanted to let you know that we are pleased to be joined by a diverse group of participants for today's webinar, including people living with dementia and their care partners, as well as representatives from government and organizations from across the country. Before we go any further, I do want to take some time to acknowledge that Healthcare Excellence Canada continues to be on a reconciliation journey. Noting just yesterday, it was National Indigenous Peoples Day, which is both a time for celebration, but also a time for reflection. We are meeting on land that has been inhabited by Indigenous people since the beginning. In particular, I acknowledge that I'm hosting today's webinar from my home office in Ottawa, which is the traditional and unceded territory of the Algonquin people. I would encourage you now to take the time to share in the chat box who you are, your organization, or who you represent, and the territory and land you are joining us from today. I also wanted to give a quick shout out to the HEC team involved in creating and producing this webinar series, Nicole, Emily, and Jessica. Thanks also to my colleagues Sheena and Kelly, who are behind the scenes today producing today's webinar. It's now my pleasure to introduce our presenters for today, Shelley Doucette and Allison Luke, who are joining us from New Brunswick. Shelley, if you don't mind, maybe I can start with you, and feel free to unmute yourself and just say who you are.
Great. Hello, everyone. Thank you for all attending today. My name is Shelley Doucette. I'm based out of the University of New Brunswick in St. John, and my professional background is nursing. I'm a professor in the Department of Nursing and Health Sciences. I also hold a research chair focused on interprofessional patient-centered care. And I've been doing a lot of work with Allison, who's presenting with me today, over the past 6 or so years around patient navigation. So we'll speak a little bit about our history in this field, but we're really excited to speak with you today on this topic.
Thanks so much, Shelley. Allison, do you want to say a few words too?
Sure. My name's Allison Luke. And as Shelley mentioned, I'm a research associate. I work very closely with Shelley through the Center for Research and Integrated Care, which is out of the University of New Brunswick in St. John. And like Shelley, I'm housed out of nursing and health sciences, but my background is actually in sociology. And I look forward to sharing our work with everyone today.
Thanks so much, Allison. So we'll be hearing from Shelley and Allison in just a few moments, but we'll just continue on with a few more slides. So I did want to share that we are who the organization I work for is. So Healthcare Excellence Canada. So we are an independent, not-for-profit charity funded primarily by Health Canada. We have a relentless focus on improving healthcare with and for everyone in Canada. So we only launched a few months ago in March of this year, pardon me, from the amalgamation of the Canadian Patient Safety Institute and the Canadian Foundation for Healthcare Improvement. HEC supports partners to turn proven innovations, like some of the things you'll hear about today, into widespread and lasting improvement in patient safety and quality. So you might remember that Allison and Shelley presented earlier on in this webinar series back in October of 2021, where they talked a little bit about their Navicare program, which is a pediatric system navigation program. So we're excited that they've accepted our invitation back today, and they'll be discussing the work they've undertaken to create a toolkit to assist with the implementation of a navigation program for people living with dementia, their caregivers, and the care team. But before we do, we did also want to give a warm hello to our session moderators, who I know if you've joined us before, you'll definitely be familiar with them. Mimi Lowy-Young and Mary Beth Whiten, who will lend their expert perspectives to the information shared today. Mary Beth, do you want to take a moment to introduce yourself?
Sure. Hello, everyone. My name is Mary Beth Whiten. I'm 54 years old and have a diagnosis of probable frontotemporal dementia. I received it at the age of 46 years old. I am the co-chair of Dementia Advocacy Canada, which is a national grassroots organization made up of people with dementia and care partners. My work crosses many initiatives, including membership on the Ministerial Advisory Board on Dementia, established by the Federal Minister of Health, providing input into Canada's National Dementia Strategy. Also, the Alzheimer's Society of Canada COVID-19 Task Force. I'm a founding member of the World Health Organization Project Network of Expert Reviewers for the Global Dementia Observatory. Lots of other things. And thank you very much.
Thanks so much, Mary Beth. Mimi, do you want to say a few words?
Sure, thank you very much. Bonjour tout le monde. Hello, everybody. For nearly 40 years now, I've been a health executive, and most recently, I was the CEO of the Alzheimer's Society of Canada. Currently, I'm the chair of AgeWell Network Center of Excellence and a senior fellow at the Institute of Health Policy Management and Evaluation in the Dalla Lana School of Public Health at the University of Toronto. Thank you.
Thanks so much, Mimi. And we'll actually stay with you both and just hear some opening reflections. And Mary Beth, I think we'll start with you, and you'll be just responding to this question: what is important to you regarding the navigation and coordination of diagnostic and post-diagnostic supports?
Thanks, Phil. Always a good one and an important one. The standard of care and access to timely diagnosis continues to vary across Canada. Today, a person's opportunity to be diagnosed well and live well with dementia depends on factors, including their location, ethnicity, age, and whether they have a care partner living with them and an understanding of the system itself. Once a diagnosis has been made, each person and their care partner should be offered a consistent level of post-diagnostic support that is in line with recommended care. This will help us live well and is why all people living with dementia and their care partner should be supported by a named coordinator of care with whom they co-create a meaningful care plan in which they feel invested. The care plan should be reviewed at least once a year and updated as when the person needs change. Revisions should be jointly developed and agreed with the person. The delivery of post-diagnostic support for dementia is complex, spanning public, private, and third sector with funding from agencies, direct payments, and self-funding. Access to dementia care should be greatly facilitated by a named coordinator of care who has a good understanding of the person and the needs, along with how to navigate the health and social care system. Good dementia care should be personalized and lifelong, considering the individual needs and preferences of the person living with dementia, and where applicable, their family or care partner. It is important that a coordinated care plan that covers aspects of supporting well, living well, and dying well is developed and jointly agreed by the person, their family and care partner, their health and social care or professional team. And this is very much like a diagnosis of cancer. Health system navigation uses different principles such as the person-centered and strength-based. I believe that we should go even further and develop a human rights framework for dementia navigators. It should provide a critical lens for addressing spectrum of problems in the healthcare sphere, including discrimination, restricted social supports, physical environments, and breach of confidentiality. We know that for the few dementia navigators in Canada, they experience barriers to both finding and accessing services for their clients, despite their professional expertise. The reality is that pre-COVID navigation for people with dementia and their care partners was extremely difficult. And this difficulty has only gotten worse during COVID. Over the last year, there has been violations of human rights of those with dementia. Unfortunately, this will continue until systemic changes are made. Changes are required to address health inequities and human rights related to barriers in accessing healthcare and life-saving services for people with dementia. And this is where the person working as a health system navigator can play a central role. And that's why I'm so excited to hear this again from Shelley and Allison. So thank you very much.
Thanks so much, Mary Beth. Mimi, can we turn to you now and maybe you can speak a little bit to how we could use technology to support the coordination and navigation of post-diagnostic supports?
Thank you very much, Neil. I'd like to make a couple of key points about the answer is yes, technology can be used to support coordination and navigation. What we have seen, which is very interesting as I have been close to this health system in recent times, as a result of COVID-19 pandemic, we've seen an interesting resilience and adaptability, which has been demonstrated by health and support services providers across the system, where there's greater interconnection and greater willingness to work together. The barriers seem to have come down a little bit as a result of COVID and people really, health professionals and organizations trying to work together. We've also seen a convergence of technology, digital media, and mobile devices, which enables individuals, care partners, and healthcare professionals to access data and information more easily and in a more secure environment. So let me share some examples of technology that can support coordination and navigation. We've seen the use and increased use of remote monitoring through sensors or other devices, which can assist to identify issues with an individual in terms of their status, and the reaction by the health professional or the support service organization to react appropriately to changes in the individual's condition from a remote environment. Digital messages can remind the individual living with dementia to perform activities of daily living and adhere to treatment regimes. Also, there has been a connection there can be a connection to the health service provider virtually through secure email. There is also the use of voice-assisted technology to support the individuals living with dementia and their care partners. In a recent survey undertaken by AgeWell NCE, active use of technology by older adults and care partners has increased during the pandemic. 88% of older adults are accessing the internet daily, and 80% are using smartphones to connect with care providers, family, and others, including video calling, as well as the use of social media, online services, etc. In order that the many uses of technology can be fully exploited, government needs to ensure equitable accessibility regardless where an individual lives, and ensure and give confidence to older adults and their care partners to manage transitions and interventions in a secure and safe environment. It is critical that older adults and their care partners are engaged in the development of technological solutions to improve access to care and services. My last point is direct human interaction will not be replaced by technology, but it surely will improve care and support of individuals living with dementia and their care providers. Thank you.
Thanks so much, Mimi, and to Mary Beth as well. We'll return to hear Mimi and Mary Beth's reflections towards the end of the webinar, but now I'm going to actually turn it over to our guest speakers today, Shelley and Allison, to hear more about the development of a patient navigation program for people with dementia, their caregivers, and the care teams. So over to you both, and feel free to just say next slide and we could advance the slides for you.
Thanks a lot, Neil, and thank you very much, Mary Beth and Mimi, for those comments, because they're just it's a great place to start our presentation. So just quickly, the title of what we're going to be talking to about today is the development of a patient navigation program for people with dementia, their caregivers, and the care team. And it'll be myself and Shelley Doucette who will be presenting. Next slide, please. So just to situate things and to give us all a little bit of background, so we're all coming from the same place, and this is going to be information that, well, frankly, has been already mentioned, and I think most of you are familiar with. We know that the current system is fragmented and very difficult to navigate. We also know that populations, especially individuals who live with a variety of complex care needs or healthcare needs, can experience lots of gaps and barriers when they're trying to move through the system. And when I say the system, I mean, really, it's not just limited to the healthcare system. This is when we're trying to move across even sectors. So social care systems, it could be for some folks, the education system, as well as the healthcare system. And sadly, this complication, this fragmented care can lead to a variety of poor health outcomes. Now, what we do know is that patient navigation as a model of care is something that can really improve care coordination, care integration, and hopefully help to alleviate and improve some of these poor health outcomes that we see. Next slide, please. So just to quickly give a brief discussion around patient navigation, because we know that often patient navigation can be used interchangeably with care or case management. And I just want to make sure that we're clear what we mean by patient navigation when we say patient navigation. So patient navigation was developed in the 1990s by Dr. Harold Freeman. And at the time, he is an oncologist. He was working in Harlem, in New York, and he was very concerned about the health outcomes of uninsured African-American women with breast cancer, diagnosis of breast cancer. And these women were having a very difficult time accessing not just support services within the system, but actually getting access to specialists and follow-up care. And so he came up with this really great idea around, at the time it was around peer navigators. I think they were volunteer, and they would actually help these women move through the system, help them access services, especially if they were uninsured, and to ensure that they were getting the care they needed. And he saw a number of improvements in health outcomes. Patient navigation has grown, it's exploded in the United States. It's still considered fairly novel in Canada, but it is growing here. And it's been used to support a variety of different populations now, from people with cancer, it's still very predominant there, people with HIV/AIDS, people with chronic conditions, mental health and addictions, children and youth, and older adults. But the central premise is the same across all of these different populations. It's to guide, support, and orient patients through the healthcare system, matching patients' unmet needs to appropriate resources, which in turn will decrease fragmentation, improve access, and promote the integration of care. So patient navigation, and this is key, is very patient-centered, and it typically provides individualized care, and it supports the timely movement through a maze of fragmented services and programs across settings and sectors. And what's kind of interesting here as well is patient navigation, or the patient navigator, can be a professional, so a social worker or a registered nurse, or it could be a dietitian who's hired as a patient navigator, but it could also be a lay person, which may be, typically it would be a person with lived experience. Next slide, please. So just to situate you and folks who heard our earlier presentation will be familiar with this, and Neil, you referenced this. Our past work, we've done quite a bit of work with patient navigation, and the main program that we have worked on is called Navicare Soins La Vie. And this is a patient navigation program that was launched in January of 2017. And it's a patient navigation program that was targeting children and youth with healthcare needs, as well as their caregivers, and the children and youth just as long as they were younger than 25. And this was to sort of really capture all those different stages around receiving a diagnosis, but also transitioning from pediatric to adult care, and also capturing young people, say, with mental health problems, where we know that a number of those diagnoses don't even happen until they hit their late teen or early 20 years. And the purpose of Navicare Soins La Vie was to coordinate care for this population, facilitate their transitions across settings and sectors, connect the youth and caregivers with resources, inform them of the variety of different programs and services available, but it was also meant to be a resource for the care team. And I should also note that when we developed Navicare Soins La Vie, it was based on a needs assessment very similar to the one we're going to talk to you about today, where we actually interviewed upwards of 120 different stakeholders. We did an environmental scan of services and programs in the province, so we knew what existed, what the gaps and barriers were. We did a number of site visits to see what was being done across the country. And then from this, we've developed a whole bunch of learnings, and we've published some papers, and this just sort of gives you a sense of where we're coming from in our work in patient navigation. Most recently, we've been working over the past year and a half now with the New Brunswick Trauma Program, because they're very interested in implementing patient navigation within their program to support that patient population. And then what we're going to talk to you about today, our most recent endeavors, is to move this into looking at the implementation of patient navigation for people with dementia in New Brunswick. And what's really neat about patient navigation is how flexible and scalable it is. So it can vary by type of navigator. It can vary by the setting, the population, as well as how it's delivered. Next slide, please. And over to you, Shelley.
Great, thanks, Allison. So I'll take it over from here. So in November, we were approached, we'll talk now about the current projects. In November, we were approached by the Canadian Foundation for Healthcare Improvement, so as we all know now called Healthcare Excellence Canada, to conduct a project focused on patient navigation for people with dementia, their caregivers, and the care team. So we were awarded a contract to conduct the following projects. So the first was an environmental scan of patient navigation programs for people with dementia, their caregivers, and the care team across Canada. So that's all across the country. The second was a scoping review on patient navigation for people with dementia, their caregivers, and the care team. And finally, a needs assessment in New Brunswick to examine how patient navigation can be implemented in the New Brunswick context for this population. So let's go on to the next slide. So we'll present our findings from each of these projects. So the first project is the environmental scan. So the purpose of this environmental scan was to identify and describe navigation programs in Canada for people with dementia, their caregivers, and the care team. So we were looking at programs all across the country, and we were able to identify 11 programs across 6 Canadian provinces, and most of these programs were offered through the local Alzheimer's societies. So as you'll see on the slide here, we collected a lot of information, and we're happy to share this information with anybody who's interested in learning more about the characteristics of these programs. But we collected information on the program services, the target population, the team composition, setting, method of delivery, patient navigator title and training, outreach, whether or not referrals were required, and also whether or not they were conducting an evaluation. So just briefly, I'll share some of the findings from the environmental scan. I will say that the organizations, they did offer a very similar suite of services, with the most common being providing emotional support to clients and caregivers, and of course, facilitating linkages to other community social supports. They also a lot of them played a role in identifying barriers to navigating the system, and also played a big role too in providing tailored education and support. The included programs, they delivered services in multiple ways, and this included by telephone, in person, or via web-based services, and many of them used a combination of all of these. And going back to what we had talked about at the beginning of the presentation, this came as no surprise, but the titles for the navigator positions varied. And that was even including those within the different Alzheimer's Society programs. And so the titles included coordinator, that was the most common, case manager, navigator, social worker, seniors advisor, and dementia care coach. All of the navigators were in paid positions as opposed to volunteer. And as far as the professional backgrounds, the majority were either social workers or nurses. And also of note too, over half of the organizations reported that the navigator actually works as part of an integrated team, so not outside on its own, so they're actually embedded within an integrated team. So that's the environmental scan of the different Canadian programs. So that on the next slide, we have the scoping review. I just want to advance the slide. Great. So the purpose of this scoping review is to explore the existing literature on the characteristics of patient navigation programs for people with dementia, their caregivers, and members of the care team. So the difference with this one, so the last one we just presented on the scan was scanning all the programs in Canada, whereas this project here was looking at the published literature and the gray literature internationally, all of the different programs that are being implemented that have been published or reported on in the gray literature. So much like the scan, we collected a lot of information, and it's all listed here on the slide. It was very similar to the environmental scan. And you'll notice that the numbers are a bit different here. So we actually, since we submitted slides, we've identified more sources, particularly in the gray literature. And so we now have a total of 45 sources examining 24 patient navigation programs. And that's because some of the sources were reporting on the same program more than once. And over half of these programs were actually based in the United States. A majority of the published sources were published between 2015 and 2020. So this goes back to what Allison was mentioning earlier, how we're really seeing a growth in patient navigation in recent years. But notably too, there were actually 8 sources published in 2020 and 9 in 2019. So that's 17 in the last couple of years. We're really seeing a growth in patient navigation for people with dementia. So in the same way that most of the programs were based in the United States, most of the sources were also published in the United States, with only 5 published in Canada. And most of the programs were intended for people with dementia and their caregivers. And as you would expect with patient navigation, all of the programs were focused on connecting patients and their families to appropriate services and resources within the healthcare system or in the community. So as you'd expect then, they offered educational training or resources for people with dementia and their caregivers. And another really important function across the articles is that the programs were really there to help with the coordination of care across providers and across settings. The majority of the patient navigation programs, they were based in the community, and almost all of them were connected to primary care providers. And that was either through their team composition or through referrals from primary care providers. And most were actually delivered by an interdisciplinary team that included both clinical and non-clinical staff. Not surprising, we saw a lack of consistency in the professional titles of the patient navigators. However, most programs use variations of the term coordinator or navigator. And there was really no standard mode of delivery for the patient navigation programs. They were delivered in person using telephone, web-based communications, or again, some combination thereof. What we're really seeing in terms of mode of delivery, that they're really using personalization in terms of the way the services are delivered. And then finally, just in terms of the facilitators and barriers, we looked at that for the programs because we're interested in developing programs. So we wanted to see what's worked and what hasn't worked well. In terms of facilitators, the main facilitator was really collaboration and communication between key stakeholders, as well as formal partnerships between healthcare and community organizations. And another commonly reported facilitator was around being flexible and adaptable in terms of the delivery model. Also having a shared computer system or a specialized database that they were able to share information. And implementation barriers included finding sufficient space and record systems necessary for delivering the program and coordinating partnerships to successfully deliver the program. All right, so let's go on to the next slide. Allison. Yeah, Allison's going to share with you the findings from our needs assessment.
Yes, thank you very much.
Great.
So the needs assessment piece was done in New Brunswick, and this is where we really wanted to know what was happening with and what were the opinions, the experiences of a variety of stakeholders. So we conducted 25 interviews across a variety of stakeholders, and this included decision makers, so folks from, say, the Department of Health or the Department of Social Development, people who are affiliated with our two health authorities in the province. That would be Vitalité, which is for the French, most francophone part of the province, or Horizon Health, as well as so a number of clinicians, as well as people from community groups. So this would be, say, individuals from the Alzheimer's Society of New Brunswick, and then of course people with dementia, as well as their caregivers. And it was kind of interesting that we had a few people who are care providers who also had personal experiences as caregivers. So their interviews kind of covered two different perspectives. And I should just quickly note that we did have a difficult time interviewing people with dementia for a variety of reasons. And but we've been doing a sort of like a sister project, very similar questions. And we had some interviews with people with dementia from that project. So we actually drew on some of that rich information to inform the themes that we're going to discuss today. So just in terms of looking very broadly at how our themes were grouped, we came away with learning lots around different challenges with navigation. What would be some of the goals of, say, a dementia care patient navigation model in New Brunswick? Who should be working in this dementia care program? Who would be the navigator? What are the barriers to setting up or establishing a dementia care navigation program in the province? And what would be some of the opportunities for a dementia care navigation program? So I'm just going to go over those. I'll start just at very high level with the different themes that came out of the challenges. A number of these are going to be very familiar to many of you folks, and they've been highlighted earlier. We know that from a care provider perspective, there's a lack of knowledge around dementia, and this is both from the diagnostic piece and the post-diagnostic support. So we know that care providers actually feel that they don't have enough support around how to help their patients, how to help people with dementia and their care partners navigate the system. And that can be really onerous for them to stay on top of all of the different programs that are available. So we've got lack of knowledge around the dementia diagnosis, around navigational supports. There was also a theme around wait lists. So this would be just how onerous wait lists can be, the time that it can take to get in to see a specialist. And this can cause problems because people then don't access these services that they need at an early time. And this can lead to really running into crisis situations, which isn't good. We also know there was a lot of people spoke about siloed systems. So I mentioned we have 2 health authorities, which are divided along linguistic lines. We have 2 government departments that would cover providing services and programs for this population. We have a number of different community organizations. All this to say, a lot of these groups then don't talk to each other well. There's no real common pathway going into and through this maze of services, and that was seen as a real challenge. It was also brought up by a number of the care providers, the issues around confidentiality. So obviously we need to recognize privacy of people with dementia and their care partners, but how do we navigate maintaining confidentiality while also trying to talk to each other, and how that can be a real challenge when trying to ensure that care is coordinated and more integrated. Another one was around the lack of early navigation support. And this came out a lot in the interviews, that people really felt that you need to get that navigation piece early on after a diagnosis. From the people with dementia and care partner perspective, we really saw a lot of stuff around a lack of peer support as well as lack of navigational support. Now, this moves us into what would a dementia program look like in New Brunswick? And so we asked some very targeted questions around this. And what we found out is that they really think that we need a navigator who's going to act as a liaison across all these different settings and sectors, that it's really key that there's access early on in the disease journey, so right after diagnosis. The general goals for this role would be around care coordination across the whole team. And of course, that's very broad speaking across the different social and health sectors, as well as improving the communication across all the different parties. And it was really key that the patient navigator takes a person-centered approach. In terms of the background for the patient navigator, although a variety of different roles or training or backgrounds were brought up, it was pretty much across the board, people felt that a registered nurse or a social worker would be best suited for this role. It was also believed that the program should be community-based and it should be primarily delivered in person. And again, this piece came up that it should be as soon after a diagnosis as possible. In terms of barriers to implementing such a program in New Brunswick, we have a very rural province, and that was raised as an issue for a variety of reasons, but one of them being that where we have so many rural dwelling older adults who will receive a diagnosis of dementia or who currently have a diagnosis, they may not have access to the same program. So that can be a barrier. The language issue, so we have to always be conscious about making sure everything's bilingual here. And then of course, one of the challenges that was raised, this sort of siloed nature of how the landscape right now, that could be a real barrier. In terms of opportunities though, it came out in the interviews that we're in a really nice situation where New Brunswick is small. And we do tend to know each other. And so there's this idea that can be a great opportunity for actually implementing a program and seeing some success. And I'll pass it back over to you, Shelley.
Great, thanks, Alison. Okay, to the next slide. Okay, in terms of our next steps, so the findings from the environmental scan, the scoping review, and the needs assessment that we shared with you today, and along with our previous research, which we also shared at the beginning, are informing the development of a dementia navigation program in New Brunswick. So we recently submitted an application to the Healthy Senior Pilot Program, which is a New Brunswick government-funded research funding program. And we submitted an application to pilot a patient navigation program in New Brunswick for people with dementia, their caregivers, and the care team and also to evaluate this initiative. So in terms of this project, we just want to share a little bit of our plans with you guys today so that you can learn about some of the work we're doing, right, that we're hoping to do around patient navigation for this population. So for the first phase, to ensure that the intervention and the role of the patient navigator is tailored to the local communities, and also to begin planning for sustainability from day one, because the program we're implementing, we're intending for it to be a program that will be not just a one-year research project, but something that will be embedded within community practices. So we're conducting a co-design process with these different participating sites that we're working with. So just as an example, to ensure that the navigators have the appropriate professional background, we're going to implement either a registered nurse or a social worker. And it'll be really the local communities in who will help determine this also into taking into consideration the existing team. So after this co-design period, we're going to pilot the program for 12 months. So the first component of the program is to pilot 8 patient navigators within rural and urban clinical practices across the province. So I also mentioned we do have the 2 health authorities, one francophone and one anglophone. So we'll be implementing them across the 2 health authorities. And we're also going to implement 2 to serve First Nations people living on and off reserve. And so we've learned through our previous research implementing patient navigation programs and also the findings from our needs assessment, the program really needs to be embedded within existing practices to promote the integration of care. We've had the experience where we've implemented a patient navigation program sort of outside in an academic setting delivering it, but for this project here, they're going to actually be embedded within community health centers and different primary care practices across the province. Again, to promote the integration of care, but also thinking ahead to sustainability. A unique feature of this program too is it's not only going to serve people with dementia and their informal caregivers, but also the care teams such as doctors, registered nurses, and other health and social care providers. And our province-wide needs assessment has really shown that care providers across both health and social service sectors, they experience many barriers to finding and accessing services for their client. And this is despite their professional expertise. So we can imagine how challenging it is for people with dementia and their caregivers who don't have this professional background. So the second component of the program will include 3 virtual peer-to-peer navigational support groups. We're going to host these on Facebook, and they'll be moderated by a patient navigator on a rotating basis. So the groups will target people with early onset dementia, people with later onset dementia, and informal caregivers of people with dementia. And so using Facebook, individuals will be able to share their lived experiences and knowledge of not only available, but also effective services and programs, because they know firsthand which services and programs are most useful and provide the most support. And finally, of course, we'll conduct an evaluation to examine the project's impact and determine whether or not it's achieved its intended outcomes. So we go on to the next slide. So here you'll just see that we're developing, and this is part of the work we've engaged in with Healthcare Excellence Canada. We're developing resources to help others, ourselves, of course, because we're doing this, but also to help others develop a patient navigation program. So we have these repository of resources. And so in the first 3 resources are those that we presented here today. So the findings from the scan, the scoping review, we feel that these will really provide organizations such as community groups, folks on dementia, and other programs with contextual information to support them in developing and implementing patient navigation programs for this population. We'll also share on this resource as well our needs assessment report, just that goes over the findings Allison was presenting earlier, just to see what the needs were. I mean, it is conducted in New Brunswick, but one thing we've learned, because we are doing some work across Canada, is that the navigational needs and the barriers they experience transcend provinces and even internationally in many cases. So we'll be sharing that report. We also, within the repository of resources, will be including our needs assessment methodology. So for that, we have a variety of resources that we use to conduct our needs assessment, such as, because we ran as a research project, we have all of our consent forms, the interview guides for all of the different stakeholder groups. We had 5 different stakeholder groups with very targeted questions for each stakeholder group. So for example, people with dementia, caregivers, health and social care providers, decision makers, and other stakeholders who are involved through nonprofit organizations. So we have all of these resources that we're sharing through the needs assessment methodology piece. And then finally, the last resource we have listed here is a repository of resources that will help somebody who's interested in actually developing and implementing a patient navigation program. So if you've done a needs assessment or if you've already done one, to identify there is a need, well, this last resource is support to actually develop and implement a patient navigation program. So with this resource here, we've included things like intake forms, welcome emails, a number of different policies and procedures that we plan to use, and we've used as well for other another patient navigation program, information authorization forms, and so on. So lots of different tools and resources that you can use and adapt to suit your unique setting. So on the next slide, we just have a call out here to see if anybody's interested in getting any support from us, whether you need help in conducting a needs assessment or if you're looking for some support around implementing the program, or maybe to actually evaluate the patient navigation program. We're always looking for ways to collaborate with other folks. I saw there was a comment just came into the chat about collaborating with other provinces on outcomes and best practices. We're very much open to collaborating. We've been doing a second phase 2 of our environmental scan that we're involved in, is actually not just collecting the characteristics of the patient navigation programs, but actually meeting with all of the different patient navigation programs in Canada to have in-depth one-on-one conversations with all of the different programs to really find out what their facilitators and barriers are to implementing, learning more about their best practices and so on. So that's a piece that we're engaged in as sort of a phase 2 for our environmental scans. We're very happy to help others who are interested in collaborating with us in that area. So on the next slide, you can see our contact information. I saw a question pop up about contacts. So the next slide is conveniently our contact information. So Allison and I are very happy to meet with anybody who's interested in learning more about this project, or if you're interested in partnering in a way, or if there's any way we can support you. Very, very happy to connect with groups or people one-on-one. So just again, this is our contact information, and feel free to reach out. And then finally, on our last slide here, it's just a thank you. We want to gratefully acknowledge our funders, so Healthcare Excellence Canada, and also the New Brunswick Innovation Foundation, and in-kind support through the University of New Brunswick. We also want to thank for the contributions we received from the Canadian Agency for Drugs and Technologies in Health, also known as CADTH, along with our project's advisory committee. So members of the committee included Lisa Poole, Mary Beth Whiten, Stephanie Smith, Calvin Young, Jennifer Major, Camille DeLong, Nicole Pollock, and Neil Dimer, and also Grayling Antonianson. And I just want to say a special thanks to Grayling. She's our team's research assistant. And I'll say she's gone above and beyond to help us complete all of this work. I think realistically, we probably were overambitious in doing this in such a short time. It's a project that could have easily taken 2 years to complete. So I just really want to acknowledge all of Grayling and Allison's support too along the way to complete this project in such a short period of time, especially during the pandemic when we know research is very challenging to conduct at this time. And just a final thank you, we want to especially thank all of our patient and caregiver partners who've really been informing this project through all steps of the way. So thank you to them, and thank you to all of you for listening to our presentation today.
Thanks so much, Shelley. And Allison, I could tell already that the questions are starting to come in, and I really, there's so much learnings that you already shared, but I think we'll come back to you in a moment with some additional questions. Before we do that, folks, continue to chat in your questions, or if you want to speak verbally, please raise your hand under the reactions button on the bottom right-hand corner of your screen. But before we do that, we just like to now ask our audience a few questions about the presentation using a live poll. So the first question, prior to this webinar, were you aware of this project? And the second question focuses on whether you know more about this project than you did before participating in this webinar. So we'll just take a moment for folks to answer those questions. And we also want to remind people that, we only have about 11 minutes left. So if we don't get to your questions or comments today, we will endeavor to answer and summarize that in the post-webinar synopsis that we shared, or that we will share in the next few weeks. So with that, I'll now turn it over to Mary Beth and Mimi to share some reflections on what we've heard today. Mimi, are we okay to start with you?
Sure, thank you. I'll be very short and brief because I think there are a lot of questions and I want to give people the opportunity. All I can say is bravo. You've done a superb job. And I think what stands out for me is you've identified some of the barriers. You've included what seem to be barriers into your program. But I think what I want to leave everybody with is there's a potential for a community of practice here in terms of collecting the navigation programs across the country to learn from each other, but so that we don't do so many pilots in different parts of the country, that we learn from what you have gained through your work and your needs assessment and your implementation and your willingness to share your resources with everybody, I think is fantastic. So all I can say is bravo and keep up the great work. I think it will really make a difference for people with dementia who've been diagnosed with dementia and their care partners. Thank you.
Thanks so much, Mimi. Mary Beth, over to you.
You know, again, I just wanted to say thank you to you as well. At the National Dementia Conference held in Ottawa in 2018, I was the individual who spoke about navigation to 250 people. And it has been incredibly frustrating to see the lack of effort or even desire, it seems like, to move forward with this. So, I just think you guys are doing stupendous work. We need you to continue this work. And so it was interesting where, when you're talking about opportunities, how small the province is a good opportunity. I think you can add one more thing there, which is it's COVID. This can be used for you to actually get more money and really be able to showcase this. People are interested in changing the way our healthcare system is and operates. And, it's election time coming up. People need money and want money. So I think there's some really good political opportunities here to help you move this forward. So really well done. And thank you for it.
Thanks, Mary Beth. And I'll just, in the moments we have left, we'll focus on some questions. And I think you've already addressed some about collaborating with other provinces. We got a couple from Grace Park. Grace is asking, do you have an evaluation framework for the impact of the project? And I bet you do. So Shelley and Allison, I don't know who wants to answer that one.
I mean, I'm happy to jump in. We have the evaluation framework that we had used when we first did, and I talked about Navicare, which is the program that was targeting children and youth, but you can use a similar evaluation framework. And I will say it's a challenge because when you're trying to evaluate the effectiveness of navigation, it's not like you're evaluating the effectiveness of, say, I don't know, a literacy intervention or an intervention that's trying to bring people together to improve social isolation, where you can sort of do it before and after. Navigation is about connecting people to programs that will then help reduce isolation, like target a whole variety of issues, help them with care planning or how to live more independently at home. There's a whole host of these things. So it can be quite challenging. And what we found worked best with us is to look at a couple of pieces in terms of evaluation. It would be once you get through the intake process. So when the patient navigator is working on intake, to identify goals, which is done with the person who's calling. It's not based on what the patient navigator thinks. So it really is individualized and person-centered. Once those goals are developed, you can at least look at were those goals met. And then what we did was then have a satisfaction survey, which gives you a brief little snapshot as to whether people, that just kind of gives you an idea of whether people liked the services they received through the patient navigation program. But then we follow it up. And usually you have to have a waiting period, maybe 3 months, but it could be a little longer, where we then conduct interviews with people, sort of a good open-ended questions to really get a sense of what their experience was with the navigation process, the patient navigator, as well as were the programs that they were connected with really useful, right? Were we doing what we said we wanted to do? Because it's not just about connecting people to a program. It's got to be the right program in a timely fashion that actually meets their individual needs. So so all that to say, yes, we have pieces in place, and the idea is we can then apply that when we go to evaluate this program.
Thank you. And here's another one from Grace, and then I see one from Wendy. So I think we'll have time for these last two questions. How were you able to embed patient navigation primary care clinics from your past experiences, I guess?
Great, so I can jump in there. I think so. This is the project that we're currently pursuing, but there's also in our scoping review and environmental scan, there's evidence that other practices have done this as well successfully. But in our case, we have also, so we do a lot of work around patient navigation, but we also do a lot of research around case management as well. So we already have a history of implementing case manager roles in primary care clinics. So we've already built relationships with people involved in health administration and decision making. So we met with folks across the province who we have developed some partnerships with, and we engaged them very early on as we were developing the project to see what sites might be interested in implementing a patient navigator within their site. And I can say that, especially in one of our regional health authorities, there were more practices who were interested in implementing a patient navigator within their setting than we could even have the capacity to support. So I can say in New Brunswick, there's a real keen interest in implementing them within the clinics and even providing in-kind support for space and so on. So there's a real interest, and they see it as an opportunity to alleviate the strain that many of the care providers are facing within their practices, because they know they don't have the time or capacity to meaningfully care for these patients in the way that they hope to. So they actually see it as a real opportunity to ensure that their clients receive optimal care, but also frees up their time so that they can help their clients with other needs beyond just the navigational support. So they see it as a real opportunity to support their practices in a very integrated way.
Oh, that's great. And Wendy is asking,
Yeah.
so they're in the midst of redesigning a program for a post-COVID world, recognizing that both in-person and virtual support has benefits. So did you come across anything that supports such a dual model?
Yeah, and that's more common than not to have a dual model. So we saw in the literature, it's a lot around having that telephone-based support, web-based support, in person. So it gets to really that patient-centered, personalized approach. So really, there's some clients who really want to have the support face-to-face, and then there's some who prefer to have it remotely. And sometimes it's just geographically, logistically impossible to get in. So we found the evidence in literature really supports using a patient-centered approach. And in doing so, the mode of delivery needs to be flexible and adaptable as well to the needs of the client. They can vary over time within clients. So there's some needs where they can quickly address it over the telephone, but then, if there's more complex issues that they're faced with, it may require face-to-face. So that's definitely noted in literature, and that's the model that we'll be using for our practice as well.
Yeah.
Wonderful. And thanks to Shelley, also shared the link to their annual conference that you guys host, and also Sharon Anderson is shared a great link on some of the challenges. I guess related to navigation and family caregivers, and some of the challenges that caregivers face in terms of navigation. So thank you for sharing that. We are pretty much at the close of our webinar. So I did want to mention that some of the resources that Shelley and Allison have put together will be shared and available in the next few weeks when we send out that post-webinar email or synopsis. And so look forward to that. We do want to take the time, and again, I wish we had more time to talk to Shelley and Allison about some of their learnings. I know I had some questions for sure that I'll follow up on. We did also want to thank Mary Beth and Mimi for their thoughtful reflections. Thanks to everyone who made this happen today, including our producers, the folks who are doing our interpretation. And finally, thanks to all of you for joining us today and for following along in this webinar series over the last several months. We'll now just ask you, or I'll read out a few evaluation questions which will help inform our future webinars at HEC. So overall, I was satisfied with my webinar experience. Overall, I was satisfied with how I was able to actively participate in the webinar. And finally, do you have any other comments or suggestions to improve the content shared in today's webinar? Once again, thank you to everyone. It's been a great webinar series, and you can definitely look forward to getting that synopsis in the next few weeks. So have a great day, and we'll see you soon.
Thank you very much, everyone.
Thank you.
Great job. Thank you.